Can a person with AML strengthen their immune system? If so, how?
So, for most of my patients, when they ask about strengthening the immune system, what I typically do tell them is what we commonly think of. Sleep is extremely important, eating proper diet is extremely important, and trying to decrease stress. So, really, it's the common things that we normally do to help our immune system. Oftentimes, the therapy that we give will decrease the immune system, and that's normal. Trying to prevent infections and strengthen the body, I think, is just the common things that we normally would do in terms of allowing the body to recover well.
I think that again, it initially, of course, comes down to the patient having a conversation with his or her doctor. I think where I've seen things go sort of amiss is where the patient with good intentions is maybe let's read on the internet. I'm going to take this random supplement or that's, and then they come in and they had their liver tests are all out of whack. And I said, oh, what's been going on? I've been taking this random thing that I found. Oh no, so that's something you have to be really cautious about. Really, it's about particularly some of these supplements might interact, with some of the medications that we're giving the patients, and it's all with good intentions, but on everyone's part. But we just want to make sure that conversation is had with his or her physician. So, but in terms of ways to strengthen the immune system, what we can do. So I would say first of all, what we can do on our end is we try to protect our patients as much as possible from infections. In some cases, using medications. So one thing that we do is, of course, we monitor all the blood cell counts very carefully. But one of the immune cells that we see and we look for are these cells called neutrophils. And so if you're a leukemia patient, you've probably heard all about neutrophils, and you're probably, well, what is this neutrophil? So a neutrophil is a type of white blood cell, and it's kind of like the first responder of the immune system, basically. So if there's a bacterial infection, a viral infection, or a fungal infection, there's a lot of different immune cells that try to go in and take care of that infection. But the kind of the first responder there, and the one that's very, very important, is these neutrophil cells. So they're usually the majority of cells. If you look at different white blood cells in the blood, they usually take up more than half the cells of these neutrophils, usually, or so. But in leukemia patients, either because of the leukemia or because of the treatments sometimes that we are giving, the neutrophil cell number may be very low. And we look both at the percentage of neutrophils, but also what we call the ANC, or absolute neutrophil count. And so ideally that number would be above 1.5, but if it's lower than that, there can be various degrees of immunocompromise, of weakened immune system. So like 1 to 1.5 is sort of mild, 0.5 to 1 kind of moderate, but less than 0.5 is pretty severe. And actually for, I would say many of my patients with acute myeloid leukemia, they have severe neutropenia, meaning low neutrophils. And so that does put them at greater risk of infection. So I just had this conversation with a patient today. So the first thing we counsel patients on about this is really to be aware, first of all, of any symptoms of infection. And if you're not feeling well, I'm just feeling under the weather, or my stomach hurts, nausea, vomiting, etc. Upper respiratory symptoms, cough. If they're feeling those symptoms, they should take their temperature. And if you have a thermometer, first of all, to have a thermometer at home. And if you have neutropenia, and you take your temperature, and your temperature is 100.4, 100.4 or above, that's a fever. We would call anything 100.4 or above a fever. And a fever and low neutrophils, that's actually a medical emergency. So that should prompt the patient, we want you to call your doctor, basically, and make sure that they know what's going on. And that would actually prompt us to refer the patient to the emergency room. Even if they're doing otherwise okay, the problem is with such a low neutrophil count. Even though the patient might be saying, oh, I'm all right, there can be bacteria. Even the bacteria that wouldn't bother a patient with a normal immune system could still get into the blood. And so we want that patient to come, we would want them to come right away, to call the doctor and come right away to the hospital so that we can evaluate, even with blood cultures, for any bacteria in the blood and treat that, right away, accordingly. So first thing we do with low neutrophil count is counsel the patient about making sure that they take a fever or any kind of infection seriously. The second thing that we always do is if it looks like the neutrophil count is going to be severely low in a leukemia patient, perhaps they're on treatment, and maybe going to be low for a long period of time, we also start the patient routinely on preventative medications. So we start them, even if it's severely low, on 3 different medications to prevent risks of bacterial infections, viral infections, and even fungal infections. And there are various medicines that we use, and again, that's where you just want to be talking to your physician. Often it's something like levofloxacin antibiotic, for bacteria, acyclovir or something like that for viruses, or posaconazole for the fungus. But the important thing is just to be in close touch, with the physician, and making sure that that the right medications are being used to reduce the risk of infection in that setting. In terms of what can a patient do to improve the immune system, I wish there was a sort of a magic kind of supplement or anything that we could do. The fundamental problem in a leukemia patient really is the leukemia. And so, it's really tough to get, good, healthy levels of immune cells until you can really get rid of that leukemia. So the whole goal of our treatments really is to try to eradicate, to get rid of the bad acute myeloid leukemia cells. And then once we've gotten rid of them, hopefully, ideally, the good bone marrow cells then have time to recover. And after they, recover, then you'd be able to restore, normal levels of infection-fighting cells.
So patients with AML frequently have a weakened immune system, and that immune system can be weakened when their blood counts are extremely low, but also when their blood counts aren't extremely low. It's important to understand whether or not your white blood cell count is very low, specifically your neutrophil count, in something we call neutropenia, when your neutrophil count is very low. At that point, you're at a higher risk of having infections, and we do several different things to try to mitigate or reduce the amount of infections patients have when they're neutropenic. One thing is we give antimicrobial medications, antibiotics, antifungals, antiviral medications to try to prevent an infection from occurring. We also counsel patients on avoiding other people or family members who are ill or not well to try to prevent infections from occurring. So there are many ways that we try to be careful with patients who have AML and have a compromised immune system.